Welcome to this week's edition of Health Corner. I'm Dr. Bakar. This week we have a consultant who will talk to us about mental health stress. This post-COVID period had seen a lot of people going through different mental health stresses. We are lucky and privileged to have in our midst today Dr. Sandeep Bansal, who is a consultant in psychiatry. He's one of the hundreds of consultants looking after the Essex-wide Psychiatrist Trust. Dr. Bansal, you're welcome to Health Corner.
Thank you very much for inviting me.
You know, COVID has brought a lot of mental health problems to the fore. And being a GP, we know what we see on a daily basis. You are a specialist. I know you see more than we do. Are you able to tell the audience what your experiences has been in this post-COVID era?
Sure. So what we have found is that because COVID period was an anxiety-provoking situation for everybody, not so for the general population, because it is new and nobody knew about the condition and how it was spreading. So the number of cases in mental health has increased significantly over the last, since the COVID period began. So we estimate that that number has been increased by 2 to 3 times. So what we have observed is the depression, the anxiety, and the use of alcohol has increased significantly.
Right.
So in patients, in general population as such. So, and this has also increased the stress which they are going through. So the stress has not been accounted for yet. So quite a few people, in fact, a lot of professionals who are working in the forefront, for example, doctors, we have seen them coming up with lots of issues with their mental health. What they are claiming is, what they are presenting with is problems with their mental health, which has increased by 25 to 60%. And especially people or the professionals working in ICU settings.
Right.
So that has increased, they have reported problems with their mental health up to 60%. So there are quite a significant number of people suffering from it, especially the frontline workers. The children, it has disproportionately affected. It has affected the older adults disproportionately as compared to the whole population.
Yeah, I could understand the ICU doctors are the ones who treat the very complicated ones that require long hospital stays and under very difficult conditions, isn't it? What about in the community? I'm talking about the Black, Asian, minority ethnic group, yes, part of our communities. Has there been similar increases?
Yeah. So what we have found is that people who are from Black and ethnic minority group, they have increased, the numbers of the mental health illness has increased in them as well. So as I said, that this is the general population which we see from 2 to 3 times, which has increased, but it has also disproportionately more affecting patients, people from Black and ethnic background, social economic status who's is poor, or people who are working in the forefront. They are disproportionately affected.
So the healthcare workers.
Healthcare workers, or for example, the worker, people in the industry of travel, who are like the policemen, firefighters. So they have increased as well because they were always working.
Yes.
So we have found them.
I listened to your interesting television program on loneliness and depression.
Yep.
I know with the lockdown, has there been similar increases?
Yep. So what we have found is that there is an increase in anxiety, and generally when they are, the lockdown has increased the loneliness in patients, in people, in general population as such. So what they have, because they are not able to meet people, they are not able to go out as they were before. They were restricted in terms of going out for example, breaks, on holidays, etc. So it has affected quite a significant number. And what they are presenting with different symptoms to us as well. So quite a few of them are presenting with irritability, insomnia, unable to, feeling lonely, alone, and not able to express themselves. They feel that they are quite nervous and restless at times. At times they feel that they are not able to concentrate. So especially the children group or people under the age of 16, it has some of the research studies or some of the studies suggest that it has affected the concentration for as much as 77% of children.
Oh, really?
So it has affected in children quite significantly. And also from the age of 16 to 39, there are the anxiety has increased by 3 times as pre-COVID. If you compare it from post-COVID to or COVID period to the pre-COVID period, it has increased by 3 times.
What we don't know is if the anxiety is due to the fear of the COVID, or is it due to the stress of the lockdown, or is it because people are losing their jobs, or is it because families are put into the one or different types of stresses by coming together? I don't know.
I think you are absolutely correct. So it is a combination of all. So it is the combination of COVID. The most important is the COVID, because everybody is stressed about, nobody wants to die, and nobody wants to be affected significantly, seriously by it. And we have seen quite a significant number of people who have unfortunately died of this illness. So that brings anxiety. And we have also seen that because of the lockdown, which was done to contain the situation, that it is more of people are not able to go outside, they are not able to go things which they used to enjoy. For example, going to theatre, for example, going to have meal, for example, meeting friends and family as usual, going outside in gyms, etc. So these are the places where they used to enjoy, and that has stopped suddenly. So it has affected them. And people who are, for example, young adults, they are new into a job, and they are the first one to go or make redundant if the job goes. So the job stresses are there. So it has affected them more as well. So I think so it is a combination of all of them that has caused the illness, the increase in numbers.
So one group we don't know about is the children. Obviously they under 16s. But I'm talking about the ones that can't express themselves, under 5s. What are the different ways this group of people might manifest stress or anxieties or mental health problems?
So that's a very good question, because what we have found out is that there is various types of surveys which have been conducted, and in those ones, what we found is that around 31% of kids or children under the age of 16 reported themselves to be lonely. They are not going to school, they are spending time by themselves, they are not going outside to play in the garden because everything is there, everything is under lockdown, they are not going outside on holidays, etc. So, and they present with loneliness, feeling lonely, nervous, restless,
Yeah.
anxious, irritable, and unable to concentrate. So they are not
Yes.
able to, for example, concentrate on their work. They feel quite anxious about things. And in psychiatry, we also talk about something which is not said. For example, if parents or people around you feel anxious, you automatically start feeling anxious.
Yeah, right.
So if the children's family members are feeling anxious, they do feel as well.
Yeah, right.
So disproportionately more. So I think it is a combination of everything. So it is a very unique situation which we are in.
It is.
And it is quite interesting thing that people are, the children are much more affected because they don't know what is going on.
What is going on?
They are. It's a completely change of their, change of the way the life is at the moment.
Yes.
Earlier they were presenting, they haven't seen masks, but now
Yes.
everybody is on masks.
On masks.
So it is a very challenging time for
Yes.
them.
Yeah. So, talking about children, the little ones who are under 7, 5, may be manifesting anxiety and stress, but because they don't express themselves, what are the signs parents should look out for to say, oh, this child is possibly having anxiety symptoms?
So they can present with several signs of feeling anxious. So the most common what we see in children are they feel they are irritable, they are restless, they have difficulty in the making concentration. They feel quite nervous around people. They feel lonely in themselves. So when you talk to them, they will come up with that they are not feeling, they feel lonely and aloof. So these are the things which we have observed in children that they come up with when during this COVID period.
Right. So I remember some parents will start wondering, well, why is my child bedwetting after being dry?
Yep.
So constipation, are these all some of the things?
So yes, so we know that the bedwetting is a feature. It can happen in related to the anxiety. So if the child feels anxious, it is not uncommon for them to do present with bedwetting.
Yes.
So it is, yes, it is related to it as well, one of the features.
Right. So talk about alcohol. Has there been increase in consumption of alcohol, of domestic violence that follows things like?
So what we have seen in observed in our outpatients is that the number of patients who are presenting, or the surveys suggest that the number of people who are drinking alcohol has increased by 20%.
Right.
And it has disproportionately increased for women. So it has increased by 45%
So
in
women are more.
So women are more drinking during this COVID lockdown as compared to men. But again, everybody is drinking more.
Yes.
People who drink alcohol and enjoy alcohol, they are drinking more. But women are drinking much more. So it may be because women we know are sometimes have different ways of dealing with their anxiety, and this is sometimes they feel that is helpful. So it is like self-medicating to calm themselves down, and with men as well. But again, it is could be that could be one of the reasons.
Yes, I know you're a specialist in old age psychiatry. Do you notice among the older generations, obviously, the fear of dying from the infection, or being in lockdown, not seeing families? Has that contributed in any way to their mental health?
Yes, you're right. So it has affected older adults in quite a significant manner. We are seeing the number of patients presenting to us has doubled in the last 1 year or so. And what they are worried about is not only, they are worried about the health. They are worried about spreading it. Because they are the most vulnerable people.
Yes.
And we have all we all know now that COVID deaths are disproportionately more in patients above the age of 65. So in fact, most of the deaths are above the age of 65. So people are anxious about it. So they are getting anxious, and then they present to us much more.
Right.
So it is very, very common, and it has affected them quite significantly.
Right.
So they are not able to go outside. Some of the older adults who are living alone, and they are not able to see their family members, or they need carer support, and the carers are not able to come to them because of the COVID period. So it is significantly, we have seen some patients getting admitted just because the carers are able to not reach to them and provide that care what they needed. Or the family members could not, who are the family members providing the care for their families or their dads or mums, and they are not able to do so now.
Right. So talking about the socio-economic class effect on mental health and stress, with the COVID era, was there disproportionate increases among the low-income families, or is it the same across the board?
Well, that's a very good question, and it is much more. It has affected much more in patients or in people who are from deprived socioeconomic status. So, for example, in patients who are from a good socioeconomic status, it has increased. But with the patients who are from the deprived, it has increased much more. So it becomes from 2 to 7 times sometimes. So twice the illness to 7 times the illness in a particular place. So the poorer the state or the poorer the place where the people are, the more likely they will develop the chance or develop a mental health problem.
Right, yeah, because one of the things we noticed is the disproportionate death among the Black, Asian minority ethnic groups in the country, in England, in the United Kingdom. Yeah, is this due to mental health problem, or is it because a lot of them are frontline workers? I mean, or is there a combination of factors?
So there is a combination of factor. So we know that for Black and ethnic minority people are generally immigrants who have come here and they started their career here. So they are mostly they are working alone, and with the lockdown and other things that has affected them. So it is also that they are working in the front line. So most of them are working in the front line, and some of them are also from living in a very poor socioeconomic state. So that has affected them as well. And we don't know why the COVID has affected. I'm not sure about why it is affecting more in the Black and ethnic minority people, but these may be contributing factors. But I think more research needs to be done in terms of why it is the case.
Oh, thank you very much, Dr. Bansal. Viewers, Dr. Bansal has just talked to us through the different causes of the increased and disproportionate mental health problems during the COVID period compared to other periods. And I know that we're going into the post-lockdown era, which is obviously starting in a month's time. But stay tuned, we're going to take a break, and when we come back, we'll hear the consultant's advice on what we can do to help with these mental health conditions that has increased with COVID. Thank you. Welcome back to Health Corner, second segment. Today, dealing with mental health stress. We have the consultant, Dr. Sandeep Bansal, who is talking us through what has been going on with a lot of people during the COVID, and now we're going into the post-COVID period. Dr. Bansal, I know you mentioned that there are other causes of stresses and anxiety during the COVID period that accounted for the increase we saw. We're still seeing anyway because people are still being afflicted. So what are those other factors? Do you have some other factors you want to share with us?
Sure. What we have observed is that people who are from, as we discussed earlier, from poor socioeconomic backgrounds,
Yes.
who are single, who are retired,
Right.
who are living in a rental property,
Oh, I didn't know that.
who are, for example, disabled,
Yes.
they are disproportionately more affected by it.
Right.
People who are, for example, in a married relationship or have their own or own their own home and not disabled or not suffer from mental illness, they are less likely to develop anxiety and stress.
Right. So a lot of the ethnic minority, the BAME, a lot of them are renting. I know there are a lot of them that have their houses anyway, but so that could be a reason why they are disproportionately affected by.
Yeah.
Oh, right.
So we know that the rentals are, that is my view, that rentals are generally not very lavish, and there are lots of flats or apartments which are rented rather than big bungalows. So it is more like, and during the lockdown, the space is cramped. So you can be on each other's toes. You feel claustrophobic, when you're not allowed to go outside. So that could have an impact on it. So, and hence the socioeconomic status, and hence could be because of that BAME group is affected, because they are mostly immigrants coming from outside working here, and that could be one of them.
Right. That's very interesting. Thank you for that. So we'll go into the treatment options. Obviously, one of the things we look at in this program is how people could use non-medical option to help themselves with stress. What would be your advice to our audience?
Yeah, so I think that is what we do most of the time. So when people feel that they are feeling stressed, we all do feel stressed at some point, and it is a part and parcel of life. So it is important how we deal with it. So if we deal with it constructively, it will go away. But if we don't and we sit on it and do nothing, then it becomes more and more problem, and then it presents later on with anxiety and depression and psychosis. So we don't want that to reach that point. So the things which we can do is, when we feel stressed, we can do, for example, go outside for a walk. So exercise is very, very important. So it could be physical exercise, as we discussed, and it could be aerobics, going outside if they have a gym, or walking, running, whatever the person wants to do. It is important to do it. One more thing with the exercises, that releases the happy hormones in the brain. So as soon as, or when people do exercise, the happy hormones are released, they feel happy rather than sad. So exercise is very, very important. Doing yoga and meditation also helps in reducing the anxiety. It also makes people much more relaxed.
Right.
So obviously anxiety, a person can be anxious
Yes.
or relaxed. They cannot be anxious and relaxed at the same time. So if yoga, exercise, meditation, that relaxes the person, then they will not be anxious.
Right.
So it is as simple as that. So we recommend them doing so, because that can be done in a very small space. They don't need a huge space for it.
Yes.
So that is another thing. Then lifestyle changes, for example, if people are smoking, if they are drinking, etc., then perhaps reducing it, and perhaps thinking of stopping it. So we do not recommend, so there are lots of NHS programs which are there for smoking cessation, or converting from harmful to another, or reduction in alcohol. They can do it by themselves, or they can take help from the NHS. So either way it helps, because alcohol is a depressant. So when people feel they drink alcohol, in short term they feel high, but long term people feel depressed with it. So it is important that they don't take depressants when they are already feel depressed.
Right.
So that is another thing which they can do. Sleep is very, very important, and sometimes when people are spending more time at home, they tend to take a nap during the day, etc. That is not a very good idea. So it is because it affects the sleep at night. So even if for 10-15 minutes people sleep during the day, it affects the night sleep. So having what we call as sleep hygiene, sleeping at one particular time, waking at up one particular time, not drinking lots of fluids after 5 p.m., not drinking lots of alcohol, smoking, these all affect sleep. And exercise helps in sleeping. If they are not able to sleep, perhaps getting out of the bed and doing something rather than staying in bed, because that is not helping them. So doing something of that sort, or they can drink a hot warm milk at night time, take a bath if they are not sleeping. So sleep is very, very important. So if they sleep well, they will feel refreshed next day, they feel better with that as well. So that they can do. Another thing what they can do is about keeping in touch with family and friends. That is quite important, especially during the lockdown when they are not going outside that much. So they can use the technology, for example the phone, or for example the video conferences. We use them quite often in our professional, but there is no reason why they can't use it in their family or friends circle as well, because that helps in talking about different things, sharing those concerns, because it is important people feel that they are not alone in this, because everybody of us are facing the same problem or facing the same challenge. So if we discuss it, it is more likely that people will feel quite relaxed, and they feel that everybody is in the same boat, and they can share the views of each other. Perhaps things which improve one person can help the other. So that work like a group therapy for them. So that is another thing I would recommend to do. And if, for example, these things what we have discussed just now are not helping, then asking for help. There is no shame in asking for help. It is very, very common. It is quite a significant number of people suffer from mental illness. The pre-COVID period, we know that around 1 in 4 people suffer from mental illness, and after COVID it is even more. So you see 4 people on the street, out of that 1 person is likely to suffer from mental illness. So I think it is, so taking help from GPs, from families, from friends is very, very important.
Fantastic. I mean, you've touched on a very important aspect of this. I mean, people picking the phone and talking, because that's another form of talking therapies for them. With their family and friends. And that brings us to this stigma, because people don't want to talk, especially people from the BAME communities. The encouragement is that they should actually speak up, isn't it? And because mental health is treatable, most of them. And the more they seek help, the more they get support. And the good thing is we have a system on the NHS that supports everyone with mental health. So,
I completely agree with you that there is a big stigma, and I have observed it myself that there are people who are from BAME community or from otherwise as well. They feel that they are not able to discuss these things openly, but I think the things are changing. We see it more and more people coming out of that stigmatized position. They're coming out of that and disclose that they are being open about this. And once they are open, they see a difference, a significant difference from people around them, because everybody is there to help them getting better. So, and once the attitude of people around them change, they feel better as well. So I think it works both ways. And I think it is a stigma, but again, there is no shame in it, because it is like any other illness. It is like blood pressure, diabetes, cancer. It is all of them, but we can treat it.
That's a very good advice, very good advice, Dr. Bansal. And I know a lot of people tend to go to their faith houses to seek help. Does that help?
Well, I think it can help. So any kind of interaction, rather than staying alone in the house and not doing anything, it is better. So if their religion has got an important role in it as well, quite a few people, they feel quite secure when they talk to people and when they are more religious. So I think, but there isn't anything that atheists are more or less likely to be affected, or more likely to be affected by it. But it is what we have observed is that people who have a religion background, they are more or less likely to be affected with the stress and anxiety.
Right. So I know that, not everyone, but a lot of people in the BAME community tend to stick to themselves. I mean, that doesn't really matter, provided the person reaches out.
Yes.
And, okay.
So yeah, so it is important to seek help. So what people can do for themselves, exercise, yoga, meditation, keeping in contact with family and friends. Perhaps it's an opportunity to make contacts with people you haven't met or you haven't seen for years.
Yes.
Everybody is on Facebook or social media, so you can find them and talk to them, and build those bridges which are broken because people were busy in their life or otherwise.
Yes.
Spend time with family. There are lots of family which we see they are coming together during this COVID period. For example, the parents were working day and night and they had limited time with the children. But now this has brought together because they are playing together, they are doing things together. So it can be seen as an opportunity for building those bridges. And that is not only good for the parents, but also most importantly the children who are there in the family, who can feel much more relaxed when they are around people, and they are diverting their attention to doing something which they like, games, talking to people, etc.
Is there a place for our eating habits in our mental health? No, I just can't.
Reducing the stress in COVID period.
Yes. It's because because people have been eating junk. So it's true.
3, 2, you're right.
Yeah. So, is there a place for what we eat, in this during the lockdown period? Is there a connection?
I think you are right that people should eat healthy. So healthy eating has an important role. For example, green leafy vegetable, fish, etc. It also helps in improving the mental state of people. So staying away from fatty food. Fat is very, very important though. You shouldn't be completely cutting it off, because it is very, very important for our cells. But excess of everything is bad. So staying healthy, as we have emphasized on the exercise, sleep, eating healthy, lifestyle changes of smoking stop, cessation, alcohol cessation, perhaps reducing, perhaps doing yoga, meditation, etc. is what will make people feel better.
Very good, thank you. Well, viewers, if you're listening, Dr. Bansal has just taken us through what you can do as self-help measures if you have a mental health problem. There has been a lot of them during COVID and post-COVID, and now the lockdown will soon be over in less than a month, and that will be even more opportunity for people to interact with each other. But what he's saying is there should not be a stigma for mental health conditions. People should speak up, seek help if you cannot help yourself at home. But exercises. He keeps emphasizing on that. Use any type of exercise. Remember, exercise releases the happy hormone. Don't use alcohol because it's a depressant on its own on the long run. So, Dr. Bansal, I thank you so much for coming to Health Corner and sharing your knowledge. Hopefully, we look forward to inviting you to a future series of Health Corner. And viewers, you've been with us. I thank you for listening, and I hope you've learned a lot from the consultant who has talked to us about the different mental health conditions we've experienced in this COVID period, with emphasis on using exercise to fight mental health stress. Look after yourself, and thank you for watching. Goodbye.